which are associated with fibroids.
Okay. Thank you.
Yeah, but also others is the heavy periods they have. Yeah, the heavy periods the women have causes them to get anemia, so they become anemic. Yes.
Does fibroid kill?
Fibroid per se should not kill. The other good news is fibroids don't become cancers. This is true.
Okay.
But there are some cancers which present like fibroids. Yeah, there are some cancers. Yeah, cancers of the womb, some of them present like fibroids.
Okay.
But fibroids per se do not become cancers. Yes.
Okay.
Yeah, so as I said, fibroid per se should not kill somebody, but its complications can kill. For example, if somebody becomes anemic,
yes,
yeah, for a long period of time and nothing is done, they could die because of the anemia.
Okay.
But also the management and the mismanagement of fibroid is another big concern. So the management of fibroid, if the decision and its application is not well done, you could end up with complication which could take out somebody's life.
Thank you so much.
Yes.
Okay, doctor. Let's look at this illustration. There's an illustration we had, and it was showing us exactly where fibroids land into the uterus of
yes, I think it is illustration number 2.
Yes. We could see and we understand better. I think it's this?
Yes. So again, we can look at this. For ease of description, we usually put fibroids in the categories. There are those fibroids which are graded as 0 and they hang inside the womb. Now, when they hang inside like this, we refer to this as pedunculated submucosal. I mean, they arise from the muscle, they have grown inside and they have lifted this up and it is now hanging inside like this. Yeah. But also there are those which are bulging inside, but most of it is still within the muscle wall. So, and then there are others which are within the muscle wall, not bulging outside and not bulging inside, not bulging inside, not bulging outside.
Okay.
Then there are those which are bulging outside. Like this, as huge as this. Now, the ones which are really of importance are these ones.
Which are around the uterine walls.
Yeah, bumping inside. They are bulging inside. These are the ones which are associated with miscarriages and heavy periods. But now we're also beginning to understand that there is a chemical effect of the presence of a fibroid on the activity of the womb. That the presence of the fibroid causes the womb to go into contractions. So even if the fibroid is not peeping inside, it could cause contractions in early pregnancy and cause a miscarriage. So if somebody has fibroids, even if it is like this one, or it is like this one or this one, which is not peeping inside, and the person has had like 1 or 2 miscarriages, especially even if it's just 1 miscarriage, then it is a justification for dealing with the fibroid if you do not have an explanation, any other explanation for that miscarriage.
Okay.
Yep.
Thank you so much. Someone was asking me that that big one up there,
yes,
it grows and enlarges to a very larger extent.
Yes.
Doesn't it put other organs at risk?
Yes. So sometimes these fibroids, like these which become huge, will start hanging outside, like how this one is hanging outside, inside here. Now, you know, if it is become so big, it will press on other organs, like the intestines. It can press on the bladder. And sometimes it loses the blood supply from the womb, and then it gets another blood supply from the other organs. And that's when we call it parasitic. And some of them detach from the womb and they start wandering around. So you find the fibroid is up on the diaphragm when the womb is down. Not common, but it does happen, parasitic fibroids. Okay. So that can happen and can have some effect on other organs.
Okay.
Yep.
Thank you so much, doctor. Yeah. If you remove these fibroids, are there chances that it can grow again?
Yeah. So fibroids, as we discussed a bit, some of the risk factors for fibroids are hormones, and some of it is genetic. Yes. Now, if the risk factor is not removed, and you remove the fibroids, the risk factor will still play its role, and the fibroid comes back.
Okay.
Yeah, it's not the ones which you remove that came back. It's new ones which showed up because of the risk factor, or they were too small for you to see them. And so, because fibroids like this, one of them actually starts from one cell. That is what we know. So if it is still at the level of the cell, you may not be able to see it during the surgery.
Okay.
And so it can grow up.
And it has grown to be big.
Yes.
Thank you so much, Doctor. You can greatly have your seat.
Thank you.
We're still on the treatment, Doctor.
Yes.
How do you treat these fibroids? Do you have antibiotics? Do you carry out surgeries? How exactly do you do it?
So the treatment of fibroids has evolved over time. Some of the methods of treatment are old, others are new. We have a number of treatment options.
Okay.
The oldest method of treating fibroids is really to remove the fibroids. So it's surgery, you remove the fibroids. You can either use the usual open technique, or you can use laparoscopy, keyhole surgery.
Okay.
So you remove them out, as you can see logically. Yes. But now there are other options which we have available now. You could block the blood supply you do a procedure where you block the blood supply to the fibroid, and then the fibroid sort of dries out. Yes, so you can do that. Or you can use some high frequency ultrasound. It's one of the most recent methods of treatment, and it's effective and really one of the least invasive. The only challenge with it is the modality is very, very expensive. That unit, to install it, is quite expensive. Most countries don't have it.
Okay. Do we have it here at Bethany?
We don't have it at Bethany, but we also don't have it in Uganda. I think in Africa, maybe there are like 2 centers which have it. Now I know of only 2 centers.
Okay.
Yeah, so they are quite expensive. One unit costs, I think, about $3 million US. Just one unit.
Wow.
The simplest and the cheapest. Yeah, so it's quite costly, that unit. But if it becomes available, it is one of the best. Okay. It's ultrasound, high frequency ultrasound, and less invasive. The fibroid shrinks off.
Thank you so much, Doctor, for all the illustration. It's still Medical Mind. We are going to have a very short break. Please be part of us by dialing 0786-050-762. In case you want to direct your questions straight to Doctor, he's here in the studio and talking about fibroids. Please keep with us. We are coming back shortly.
Bethany TV for health. Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV for health.
I'm Dr. Gerard